Hello guys, welcome back to a new video of my channel. So after giving hit by hit videos, okay, so we are going to learn today's lung sounds, okay, different kinds of lung sounds. While during in medicine posting, we will auscultate the chest region, and we will see like any fluid is present, any pus is present, or air is present. Like normal lung sounds are also there. So many people can't differentiate between what kind of lung sounds are there. There are many normal lung sounds and abnormal lung sounds. So in this video, I will show you one theory along with I will make you hear the lung sounds. Okay. So without wasting any time, let's start. One more thing: use earphones for better experience. So guys, starting with the lung sounds, my YouTube channel name is Medicoman India. Insta ID is Medicomem72345, and Telegram at Medicoman India. You will get this PPT there, and every notes is available there. Okay. So let's start. First, coming with a respiratory exam, okay. Before a systemic examination of the respiratory system, it is done by inspection, palpation, percussion, and auscultation. Inspection, palpation, percussion, and auscultation. So while auscultating, you should be in a quiet place, okay, quiet space, and proper positioning of the patient. The patient should be comfortable and relaxed position, okay. And keep in mind the cloths, hairs, and other foreign objects will make additional sounds while you listen, okay. So try to do auscultate in the bare skin, okay. There should be no cloths. Now coming with the normal lung sounds, okay. First we will deal with normal lung sounds, then we will go with abnormal. Normal lung sounds created by the turbulence in the airflow. Lung sounds are created by the turbulence in the airflow. While inspiration, air moves into the smaller airways, hitting walls. More turbulence increase the sound is heard. And during expiration, air moves towards the larger airways. Lesser turbulence, decrease sound, okay. Trachea divides into bronchi, then bronchioles, okay. The size is greater here, and then it gets smaller, and it gets even more smaller, okay. So air moves from larger area to the smaller area during inspiration, and from smaller area to the larger area during expiration, okay. So there is a decrease in the there is change in the intensity of the sound. Normal breath sound, loudest during inspiration and softest during expiration, okay. The normal respiration is divided into vesicular, bronchovesicular, and bronchial breath sounds, okay. In vesicular breath sound, it is low pitch and heard over most of the normal lung, and bronchovesicular, it is medium pitched and heard over mean stem bronchi. And bronchial or tracheal breath sound, it is high pitched and normally heard over trachea, okay. These are normal sounds: vesicular, bronchovesicular, and bronchial. Normal lung sound, vesicular bronch sound, it is soft, low pitched sound. Inspiratory sound is greater than the expiratory sound heard over most of the lungs, okay. It is like inspiratory sound is larger and then followed by the expiratory, okay. Okay. Bronchovesicular, it is intermediate intensity, intermediate pitch. Inspiratory is equal to the expiratory sound, heard best in first and second intercostal space. First and second intercostal space anteriorly and between scapula posteriorly. If heard any other location, suggestive of consolidation, okay. It is like inspiration and expiration. Both are of equal intensity and there is some gap, okay. They are not continuous. But in vesicular, there is inspiration is longer and then expiration is shorter, okay. Normal lung sounds, another two are there. One is tracheal sounds. These are very loud, high pitched sound. Inspiratory sound is equal to expiratory sound duration heard over trachea. Tracheal sound is heard over trachea, okay. Bronchial sounds. Bronchial sounds are loud, high-pitched sound. Expiratory sound is greater than inspiratory sounds. Okay, bronchial sounds. Expiratory sound is greater than inspiratory sounds heard over manubrium of sternum. If heard in any other location, suggestive of consolidation. Now coming lung sounds, the bad and ugly means abnormal lung sounds. Okay, these are caused by moving air colliding with the secretions in the tracheobronchial passageways, or popping up or opening up of the alveoli. Okay, major types are crackles, rhonchi, wheeze, stridor, and pleural rub. So we will deal one by one. First, coming with the crackles. Okay, why does crackles or rails? Crackles are also known as rails. Why do we hear that? These are discrete, non-musical, non-continuous sounds produced by moisture in the lung tissue. Okay, crackles are produced due to the moisture in the lung tissue. They can be fine crackles or coarse crackles. Okay, there are two types of crackles: fine crackles and coarse crackles. We will hear both of them. Crackle sound like cell phone being crumpled. Okay, heard more commonly with inspiration as a result of secretion moving in the airways or closed airways that are rapidly reopening. Okay, crackles are because of moisture, some fluid is there. Okay, many possible causes of crackles are pulmonary edema, early congestive heart failure, asthma, and chronic bronchitis. Crackles are heard in pulmonary edema, congestive heart failure, asthma, and chronic bronchitis. Okay, let's hear the sound. Now coming to the rhonchi. What is rhonchi? Continuous sounds produced by air being forced through the narrowed by secretions or constriction of the air passage. Okay, you are forcing the air to go through a smaller space by forcefully. Okay, why it is smaller space because of the fluid or any obstruction is present. This rhonchi is similar to the wheeze. Okay, rhonchi are low pitched snoring quality, continuous and musical sound. Okay, implies obstruction of the larger airways by the secretions. Possible cause is acute bronchitis. Whenever you heard about acute, no, it will the duration will be less. Whenever you heard about chronic, the duration will be more. Now coming to the wheeze. Wheeze is a continuous musical sound produced as air is forced through narrowed passages. Air is forced through narrowed passages, like rhonchi, can occur in inspiration or expiration. With rails means crackles. Okay, with crackles may change character after coughing. High pitched sounds are usually called wheeze. High pitched sounds are usually called wheeze. Low pitched sounds, snoring sounds are usually called as rhonchi. High pitched sounds are wheeze. Low pitched sounds are rhonchi. Possible causes of wheeze are asthma, COPD, and smoking. Okay, the most commonly seen COPD cases. Okay, there you will heard wheeze. Even I heard them. Now let's hear the wheeze sound. Now coming to the stridor, okay? Loud musical sound of constant pitch, most prominent during inspiration. Loud musical sounds of constant pitch, okay? While during inspiration. Can be heard very well at at a distance due to loud intensity. No stethoscope is needed to hear the stridor, okay? You can hear it with your bare ears, okay? Suggest obstructed trachea or larynx. This is a medical emergency requiring immediate medical attention. Possible cause is inhaled foreign object. Inner for our body. Most commonly is that peanut or peas, they will go into trachea, okay? And most common lobe, that is right lower lobe, is the most common lobe, okay? Because the right trachea is very much straighter than the left trachea. No stethoscope is needed for stridor. Let's hear the stridor. Now coming with a pleural rub. Pleural rub is a non-musical sound, usually longer and low pitch than lung crackles, okay? These are longer and low pitch than the lung crackles. Longer and low pitch. Discontinuous or continuous brushing sound occurs during inspiration and expiration. Sounds like creaking of old leather. Creaking of old leather caused by coarse surface of the normal pleura due to fibrin deposits thickened or inflamed or with neoplastic cells, okay? Pleural rub means, let me show. See this will be lung, okay? Lung is covered by the pleura, okay? Means this like pleura. The pleural rub means the pleura will rub against rub because because of fibrosis or any fluid, okay? Or any neoplastic cells. This is pleural rub. Let's hear pleural rub. So that's it, guys. These are the lung sounds you must know. Hear the sounds again and again. And after this video, I will post a small rapid revision shot. Okay, watch that also. And check the comment section. I will post the same shot. Okay. See you. Jai Hind, Jai Bharat.